So the first thing I'm doing when I get in this morning is I'm going to put down all of these chairs. Usually at the end of the week, we put the chairs up really high so that the person that comes to clean the office can get underneath the chairs and get anything that we would potentially miss. So today is a no doctor day, but we will be open and available to see any emergencies that need to come in. So I'll just have you guys follow me around as I do work around the office and see any emergencies that call in today. Here are some holly retainers that just got dropped off. So I'm going to store them away in our basket where we keep our holly retainers. Here you see we only have a few because we usually make clear retainers for our patients. Every now and then the doctor will request for the patients to have holly retainers. I'm now in the sterilization room. I always like to check to see if there are any instruments left behind, just so I can keep busy. So we do have 4 ovens here. We have a lot of patients, so we have a lot of instruments, so we keep a lot of these ovens ran throughout the day. So right now I have 2 ovens that are completed, full of instruments. So right now I'm just taking out each rack of instruments so I can put them away. So we keep little indicators, which are these stickers here, just to verify that a cycle is completed and has been ran through. The sticker there is black, but initially when we first put it in, it's green. When the sticker turns black, you know that the instruments are clean. This just keeps everything organized because we have many people come in and out of here, and the last thing we want is to somebody accidentally to pull dirty instruments that are not clean. As you can see, I am putting on different gloves. I go through so many gloves throughout the day. I just am really paranoid about cross-contamination, and if I have to second guess anything, I just always change my gloves. So now that I have all those instruments here on the clean side, I'm going to make trays. We do keep trays for every procedure in our office. All of these instruments here are for our adjustment trays. So right now I'm just going to set all of these up so that they're ready. So one of the first things I learned before learning how to assist in orthodontics was sterilization. I think a lot of you watching can vouch and say the same. Most doctors and managers want you to know how to work the back, how to clean the instruments, because it is something that everybody in the office should know how to do. In this office that I'm at, we do have one person assigned to doing this, but it is helpful to have everybody knowing how to clean instruments just in case you need that extra hand. And I think it's really important just to have everyone in the office cross-trained, because you never know when someone is going to call out. And the last thing you want is to be short a person and not have another person available to help out in that position that's needed. I honestly don't mind working back here because it keeps the day rolling. Usually I find that my days are slower when the person assigned to this room is working. When I find myself having to do both sterilization and assisting, the day goes by fast, and that's something that I like. As you can see, I am using tray sleeves to cover each tray. With these tray sleeves, we also use these as headrest covers for every chair. So whenever we call a patient back, we will remove the tray sleeve and just dress it on the headrest of every chair. It can get really slow on days like these, so I'm always just trying to see where work is needed, just so I can stay on my toes. When I've done all I can do and have exhausted everything, I normally will just check the schedule for the following weeks, make sure that I'm not missing anything that the doctor needs to know prior to them coming in for that week. I also will make sure I'm caught up on care calls. Care calls basically are calls that we follow up with every patient after they have gotten braces, to make sure that they've gotten adjusted to the braces, to make sure that they're no longer in pain, and just to make sure that they're doing okay. I also will just sit up in the front sometimes to continue to train up there. I don't have a lot of opportunities to train in the front, so whenever I do have downtime, that is something that I try to do. I just want to make sure I'm an asset to the team and that I'm able to help in every position. As you can see, I'm getting all of the trays that I've completed out here in this open bay area. This is where we keep all of our trays, just so we can access them easily. We do also keep one at every chair. So I wanted to show you guys what I've been learning. So these are bonded retainers. I previously have been taught to just bond a braided bonded retainer that's already flat, but at this office I have been learning how to do bended bonded retainers. When I practice, I am using a stainless steel wire just because they're cheaper for practice. When I bend the wires, I use a bird beak, a 3-nose plonk prior, and an end cutter to cut my wire. So those are the 3 instruments that I work with. I've been learning a lot. Most doctors will bend their own bonded retainers, but here in my practice, we are taught and we are able to bend the retainers and bond them to the teeth. So right now I do have an emergency patient in the waiting room that just called in. So now I'm just going to gather a few things before I call the patient back. Right now I am cleaning my eyewear just because I don't want it to fog when I'm working, and also because they're dirty. Usually when patients call in for SOS, they'll give us a brief description of what is wrong. So when this patient called in, they said they had a wire poke in, but when patients say they have a wire poke in, that can mean many of things. I've seen patients say they had a wire poke in and they had a bracket off. They had a wire that slid over too far, or they had a wire under the bracket, or it was just the color off. So it could be anything right now. So I'm just going to wait until I call my patient back to see exactly what's going on and see what I can do to help. So I'm back from seeing my patient. Right now I'm gloving up and I'm getting ready to wipe off this chair. My patient did have a wire poking. The wire was actually out of the molar bracket, which is the last brace in the very back. So the wire was really long and poking in the patient's cheek. So I did get that wire back in the molar bracket, and once I placed the wire back in, the wire was no longer poking, and I did retie the wire. So now that I'm done wiping and cleaning that chair, I do have all of the dirty instruments here along with the tray. And right now I'm just getting this set up so they can be dropped inside the solution and then ran into the oven. Thank you guys so much for watching this video. Make sure you comment, like this video, subscribe if you haven't already, and I'll see you in the next one. Bye.